Are you thinking about starting a GLP-1 medication for weight loss, like Zepbound or Wegovy, but feeling a little nervous or unsure of what to expect? Is that you? Is that where you are on your journey? Okay. All right. So today I'm going to walk you through what I wish that I knew before starting Zepbound. Not from a doctor's point of view, but from someone living it, navigating the side effects, the mindset battles, and the unexpected victories, right? Every day. I've been on Zepbound for a little over a year. So whether you're on day one, still waiting for your prescription, day 100, or you're just curious about all this talk about GLP-1 medications, then this video is for you. Okay, so let's talk about the real stuff that no one really talks about or tells you about when you're first starting out. So I want to make sure that you have the good, bad, and the ugly of what comes with these weight loss medications or obesity management medications, right? Hello, bold, brave, and brilliant ladies and gentlemen. Thank you for tuning in to Zepbound Journey with Ange. If you're new to my channel, here we talk about all things GLP-1 medications like Zepbound, Ozempic, Wegovy, Saxenda, and Mounjaro. I'm Angela Durant. My friends call me Ange, and you can too. And I've struggled with my weight almost all of my life. I was a chubby kid from the age of 7 up. I was an overweight teen. I was active. I was doing all the things, but I was an overweight teen and ultimately became an obese adult. At my highest weight, I topped the scale at 332 pounds. I am only 5'2.5" tall, so I'm not really tall, and that was a lot of weight on my frame. And before discovering Zepbound, I had 2 bariatric surgeries. I had the lap band surgery in 2009, and then I lost 157 pounds on the band, which my doctor was blown away by. That worked very well for me for a long time. I was able to maintain that for 5 years, and then the weight started creeping back up. So in 2019, I decided, hey, I don't want to deal with my weight challenges anymore. And even though I was afraid to do it, I went and had the gastric bypass surgery. And from that surgery, I only lost 30 pounds, which I'm not sure why I didn't lose a ton of weight. I thought I would and never have to deal with this challenge again, but that was not the case for me. Okay. I was also on Ozempic and Saxenda. Both of those medications are made by the pharmaceutical company Novo Nordisk. So I've been on those too, so I can talk about my experience with that as well. So if you're someone who has struggled with your weight and you're considering a weight loss medication, if you're already on Zepbound, Wegovy, Saxenda, Mounjaro, or Ozempic, which I know many of the people in my community are, you are in the right place, okay? If you've been following me for a while, thank you for following and welcome back. And if you're not subscribed, be sure to subscribe. And if you're new here, we would love to have you as part of our community. It's a kind, caring, compassionate community where we see you, we hear you, and we value you. And if you'll also share it, if you like this episode, please share it with somebody you think it would help. And also hit the notification bell, because sometimes I go live and it's not announced, so you won't miss it. Okay. All right. So today I want to share with you 10 things that I wish I knew before I started on Zepbound. 10. So get your pens, paper, pencils, iPads ready. Okay. The first thing I want to talk to you about is hair loss. Hair loss is a mild but notable side effect that some patients experience, which is not commonly discussed in mainstream, right? We're not always talking about hair loss. But as women, the majority of people here are women. And shout out to the few good men that are here too. I think if you haven't gone bald, you may want to keep your hair, right? So that is a possible side effect. And we don't talk about that enough. We do talk about vitamins and taking, things for your hair and your nails, but that is a side effect. Okay. That's number one. Number two, and this is not in any particular order. Number two, but this is one of the most important ones. To me, I think this is the most severe thing that could happen that you need to know about, and that's around mental health, right? Mental health concerns. There are reports of depression and suicidal thoughts or behaviors. While these were not observed in the Zepbound clinical trials, they have occurred with similar weight loss drugs. And I will tell you that I have two friends who have suffered from depression, severe depression, from being on a GLP-1 medication. One of my friends was she was on Wegovy for a while. I think almost a year she was on Wegovy, and she suffered from bouts of depression, some really bad depression. And so her doctor moved her off of Wegovy and onto Zepbound. And now she's losing. She lost on Wegovy too, but she's losing, and she's healthy, and she's fine. But I want you to know about that, because I want you to be able to pay attention to anything that might be off, anything that might be different in how you're feeling as you're taking, if you decide to take this medication, or if you're already taking it and you're noticing that you are more sad, you have more sad days than you've ever had before, that you may not be connecting the dots that this could be a GLP-1 medication, right? You may not have connected those dots, but it could very well be. So I think it's important that that's something that you know about, that not a lot of people talk about. Okay. Let's go on to number three, and hopefully you're jotting these down. As you're doing your own research and going through this journey. Okay. All right. So let's talk about number three. Number three is vision changes in your vision. Okay. Rapid improvements in our blood sugar can impact our vision. It could lead to us having blurry vision or other changes. And it might just be temporary, but it could lead to that. So particularly for those people like myself who have pre-existing eye conditions, right? My eyes are not strong. I've worn glasses since I was a little girl. And so you may notice me look up like this to try to read comments, right? I'm trying to, through my bifocals, I'm trying to, make sure that I can see. And I went to my optometrist, and she said that there was a change in my prescription. She said it was normal, that it was just a slight change. However, when I heard that, and I could tell anyway, because I was struggling and I knew I needed a stronger prescription. But I've been thinking, is it because of the GLP-1 medication? It might not be at all, but it's something that we need to be aware of, right? It's something that we need to be in tune to, because it could be, right? It could be. That is a possible side effect. Okay. So I'm sharing the good, bad, and ugly with you here. I want you to know all the things so that you can make the best decision for yourself, and so that you're well equipped on the journey if you decide to move forward. And for those of you who are already on the journey, maybe some of these things are occurring and you haven't connected those dots. Okay. So number four is cardiovascular effects on you, right? Cardiovascular. People are talking about the positive cardiovascular from taking semaglutide, like Wegovy, right? That it can be good for improved heart disease, right? But there are rare cases of increased heart rate, right? Especially in patients who have a history of heart disease. So that's important to pay attention to. I've heard people say when they titrated up, they had a rapid heartbeat, right? So I want you to know these things, to be equipped with the knowledge so that you are prepared for your journey should you decide to move forward, right? These are things that can happen and you need to be aware of them, okay? All right, number five. Number five is your kidneys, okay? And I'm not saying these things to scare you. I'm not saying these things to frighten you. I just want you to be prepared. I want you to be equipped with the knowledge. I want you to know what you're stepping into, okay? That's what I want for you, okay? So your kidney injury is a possibility. So severe dehydration from some of the other side effects that we do talk about often, like diarrhea, right? But severe dehydration from vomiting or diarrhea can lead to acute kidney injury. My research says, which of course is serious, but it's infrequently discussed. People are not really talking about any injury to our kidneys, but you need to be drinking your water. You need to be following whatever your doctor tells you to do. That's what you need to be doing, okay, to keep you safe. I'm just one girl. I'm sharing my journey, but I'm not a doctor. And so you can't even, go by what I say. I can't prescribe anything to you. I can just share my story with you and make sure that you are informed, right? You're making the best informed decisions for yourself, okay? The next is gallbladder problems. Gallbladder. So number six, this is number six. Number five was kidneys. Number six is gallbladder problems. Rapid weight loss and the medication itself can increase the risk of gallstones or gallbladder inflammation, sometimes requiring surgical intervention. Now, here's what I'll tell you. I met up with a friend in January and she pulled me aside. We were at an event. She pulled me aside because we had talked about the medication. She was like, I'm a little nervous, but I'm going to do it. I'm going on and I'm doing it. And I hadn't seen her since that conversation. Well, at the event, she pulled me aside and she's like, Ange, she said, like a couple of weeks ago, I was going to go out with my husband and I had this severe pain in my stomach. I had this severe pain. So he rushed me to the hospital and I had to have my gallbladder removed. She had to have her gallbladder removed. And where the assumption is that it was related to her taking a GLP-1 medication. I believe she's on Zepbound, right? That's the assumption. I don't know for sure, but that's the assumption. That's the dots that she connected. But I think it's worth sharing with you. Okay. Number seven, you probably already know, and that is if you stop taking the medication, you can regain the weight. And if you've followed me for a while, you know that I always say that I'm a severe case and that I believe that I'd be taking this medication or some form of a GLP-1 medication for life. Even if I titrate down to maintain a certain weight, I probably will be taking it for life unless something changes. Okay. And I also want to say that we have had people in our community who were working to get to their ideal weight. And then once they got to their ideal weight, they were titrating down and their plan was to come off the medication completely, right? So some people can. And here's what I want to say. I want to tell you that everybody's different, right? Everybody's journey is going to be different. Some people lose at a rapid pace, right? I call them the super responders, right? I am not a super responder. And some people, lose weight much slower, right? You may be somewhere in the middle, right? But it's important for you to know, right? And not compare yourself to anybody else. Don't look to your left, don't look to your right. Just look inside yourself and follow your own journey, right? Select things that are right for you, what makes sense for your journey, whether that's to stay on the medication for life or to see how you do with it and wean yourself off over time with your doctor's help. You weaning yourself off. I will tell you that my nutritionist told me that even once I hit my goal weight, she does not recommend that I go off the medication completely. She said, even if we have to titrate all the way down to the lowest dose, she would recommend that because she's had patients go off the medication, lose a lot of weight, go off the medication, and try to go back on the medication. And because she doesn't have they don't have the comorbidities anymore, their blood pressure is under control, their A1C is under control, the insurance companies denied them. They're like, you're good. You don't need this, right? You don't show any signs of this anymore. You're good. So the answer is no, they will not cover the GLP-1 medication, right? So my nutritionist said she would recommend that I not go off of it completely, but I titrate down. And even if I needed to say, I'm going to take a dose every other week instead of every week, right? So there are some creative things that you can do there with the help of your doctor, but I wanted to mention that. All right, the next one. Okay, we did number 6, 7, number 8. Side effects. Some side effects can be odd and severe. So I want to talk to you about that. So you might look at all you may read everything that the medication comes with, right? And there may be side effects that you have that are not written in anywhere, right? And there are still things that are happening with these medications that we don't know everything about it, right? Somebody said to me the other day, you don't know all the things. She said that somebody said to her, you shouldn't take that medication. You don't know what can happen a few years down the road. You don't know what can happen. And her response was, you're right. Like something could happen that we don't know, that's unexpected. But what I do know is what will happen or what could happen to me if I don't take the medication, right? If I continue to gain weight, right? What's going to happen to me if I don't have an intervention of some sort, right? Okay. All right. People crack me up telling you what you should and should not do. I always say, be an advocate for yourself. Choose what works for you, what's right for you. But at the end of the day, nobody's the boss of you, right? So nobody's the boss of you, and you get to choose for yourself. Okay. So none of these were deterrents for me not to take Zepbound. Like I didn't say, oh, because this could happen, I'm not taking it. I didn't. I still moved forward because I thought about what I could gain versus what could be lost. And the gains outweighed the losses, right? But if this is, it is helpful, I will say, to know what you're getting into, right? Or to say, oh, well, something weird is happening. Is that connected with the GLP-1 medication? That's important. That's an important question to ask. So for me, the two things that were odd and severe. So let's start with odd first. The odd thing that I had, that I found that some people in my community also had, were these itchy bumps. They were itchy bumps like a big whelp on my calf that was very, very itchy. It was like a mosquito bite, like a mosquito bit me, and I had them. I would break out, like it'd be on my breast, it'd be behind my ear, it'd be on my thigh, all over. I would have after I took the medication. I don't have that anymore. That subsided. I think my body has gotten used to the medication, and that doesn't happen anymore. But that's something like normally, I think in the documents that they give you with the medication, it says that you can have you can itch or have irritation around the injection site. But those whelps were not near any injection sites. They were like in the opposite direction of the injection sites, right? So the typical injections are the tummy, the thigh, or the arm, the back of the arm. So I was getting these itchy bumps everywhere, my belly, behind my ear, my breast. Like I was getting these itchy bumps. And they were at times so itchy that I would have to take Benadryl for them. And when it first started happening, I did not connect it to Zepbound. I didn't even make that connection. So if you're somebody who struggles with, you've noticed that, if you're already taking it and you've noticed that's something that probably will subside over time like it did for me. So I want you to know about that. That's the odd thing that happened. The severe thing is that's common is the constipation. And I know that is talked about quite a bit on our in our communities. Here's what I tell you. Like, you drink your water, you do all the things. Talk to your doctor, because they may want you to take something every day to keep you regular, right? Metamucil or a daily tablet or some sort. For me, I've been very fortunate to not have a lot of severe side effects, right? And I was going along for almost a year, and I was like, nope, no side effects for me. Just those itchy bumps. That's it. That's it. No side effects for me. And here comes the big C, constipation, right? Right. And I won't go into detail on it, but what I will say is it was pretty severe, like trying to pass, the waste that needed to come out of my body. It was pretty severe. I was like getting up, breathing, walking around, like, taking the medication that I had. I would recommend you have something on hand for all of the different symptoms. Diarrhea, vomiting, constipation are the common ones. That you have something already in your cabinet, so you don't even have to go to the store to get it. You already have it there. So that was very helpful for me. But one of the things that I tell people is that not to panic, right? If that happens to you, don't panic. Take your time, breathe through it. If you need to walk it out a little bit, walk. But it was like things were compacted and would not move. And I was like, I'm not used to this. So we're able to get everything clear and cleaned out, right? But it's something you need to know about, because some people suffer from it often. I've only had 2 bouts in a year that I've been on Zepbound, only twice. But other people have to deal with it longer than that. So you might be somebody who has that. So it's important that you know about it. Okay, so we're talking about the good, bad, and ugly. So let's talk about, I want to leave you with just a few positive things. I'm your girl. I'm always going to try to leave you with something positive, right? That's what we do here, right? So you're not like, oh, I'm scared. And I hope this hasn't scared you. I hope it has equipped you, okay? Not scared you, but equipped you. So you're really powerful. You know that you are the one that makes the decision for yourself, for your life. And if you do everything that your doctors tell you to do, you should be pretty good, smooth sailing. But things do happen, so you need to be aware of those. So let's talk about some positive things, right? So one of the most positive things that I could think of is that initially, when thinking I had to inject myself with a needle, it was like, okay, I'm not sure if I'm gonna like that. And I know some people are just afraid of needles, right? What I want to tell you that I did not know before I started this journey was that it's so easy to take the medication. I've never done compounds, so I can't speak for that. But what I can speak for is the Eli Lilly medication, the pen that Zepbound comes in, okay? And the same with the pens for Ozempic and Saxenda. Saxenda I was taking every day. But those needles are so tiny. They're so tiny. And sometimes I'm like, did it go? Did it work? Right? So that if that's what's standing in your way of moving forward, I really want to encourage you and tell you it's not that bad. Okay? So that's something that we didn't really talk a lot about before going in. The next thing that I want to talk to you about that I think is fantastic that they discovered with Zepbound is that it can cure sleep apnea, right? It can cure sleep apnea, right? And then Wegovy for heart disease. So that's a big deal. That is a big deal because for me, I would stop breathing in the middle of the night. So knowing that taking this medication is helping that, and I can get a good night's sleep. I can sleep with my husband again, right? Instead of us being apart because I was snoring so loud. That is a game changer, right? That improves the quality of your life. So that's important. Now, so I want to leave you with that. And then one other thing, and this has really been a game changer for me. It's been the biggest. This has been the biggest aha for me. And I did not. My doctor did not talk to me about this before going on the medication. And I think that the reason that she did not talk to me about this, and I'll tell you what that is in a second, is because she's not on the medication, right? So she can only ask me, how does it make me feel? And ask her other patients how it makes them feel. And then kind of put together an idea of what she thinks it might look like in a person, right? However, she did not tell me about the biggest thing, and that is how it impacts my brain, how it impacts my brain and quiets the food noise. Okay, that is something that my doctor didn't talk about. She just said, "How are you feeling?" And and I said, "Oh, something happened to me the other day." Right? I was at the Staples getting office supplies, and I was hungry. My stomach was growling, and I saw candy there. And prior to taking a GLP-1 medication, I would have taken that candy and put it in the cart. And I might have opened it and started eating it before he scanned it, right? Because I was hungry. But I knew that lunch was in like an hour or less. And I was able to see the candy, but say, I think I'm okay. I'll just wait for our lunch. That would not have happened before. So I knew right away that is the medication. That is the medication in my system. And I always tell my community that if they took away all the properties that the medication can do, it empties the stomach slower, so you feel fuller, longer. My issue was never restriction. My issue was never feeling full, because I can keep eating and eating and eating, even though I'm full. What has been a game changer for me is the impact that it has on the hypothalamus, right? On my brain, that sends signals or blocks, any outside desire to overdo it, to eat things that I don't need to have. Now, I've had my ups and downs on 15 where I felt like, is it working? Did I get a bad batch? What's happening? But now I'm starting to feel the impact of it again. So I know that it's working. Okay. That is the biggest thing. If you're somebody who suffers from the disease of obesity, if you're somebody who would go out to dinner with your friends and you can't really focus on the conversation because you're focusing on the food, right? If that's you, then this medication may be something that can really help you. I know that they're trying it in other things like addictions, alcohol, different things, like people who said that they used to drink, casually, socially, don't have a desire for alcohol anymore. So this medication is truly a game changer. But what it does to my brain, is amazing. It is, when it's working at its full strength, it is absolutely incredible. Right? It's absolutely incredible. So I wanted to share that with you. And I hope, let me just say again, let me iterate, I am not a doctor. This is just one girl's journey. So please, please, please talk to your doctor, your nutritionist, talk to your physiologist, all of the care, your primary care, all of them, who, if you're deciding to go on this journey, to make sure that you are, all tooled up, you're fully supported with the people who need to support you. Okay. So I hope this episode of season 2, we are now in season 2. Can you believe it? I hope that this episode has served you, has supported you. I guess the question you might be asking yourself is, Ange, knowing what you know now, would you have gone on this journey? Would you have done it again? And the answer to that is absolutely yes. Absolutely yes. And if I don't lose another pound, I don't want to gain another pound, but if I don't lose another pound, I feel comfortable in my skin. I feel good in my clothes. And I'm grateful for the weight that I've been able to release this far, right? Do I want more? Yes, absolutely. But I am grateful for the weight that I've been able to release so far. And I'm wishing you so much success on your journey, right? Whatever you decide, however method you decide you want to take, I want to wish you the most luck on your journey. Okay. And if you haven't already, you know what, subscribe, hit that bell, that notification bell, share. If you haven't done that, please do that. You'll help our channel grow, and I will appreciate it so much, so much. And I want to leave you with this. You, brilliant ladies and gentlemen, are fearfully and wonderfully made. You are valuable beyond measure. And you don't have to do it perfectly, right? This is not a perfection journey, right? It doesn't have to be done perfectly. You don't have to rush. You can take your time. You just have to begin. Once you make the decision that you want to move forward, if you want to move forward, you make that decision. It is not wise to allow medication to just stack up in your fridge and not take it. In order for it to work, in order for it to be effective, you have to take it, okay? You have to take it and give it a try, okay? But you don't have to rush. You just have to begin, and on your terms and in your time, okay? Because the journey isn't about weight loss only. And initially, I got into this, I was like, I want to release this weight, right? But it's really about discovering the best and the healthiest version of yourself, the best and healthiest version of yourself. And if you're scared, I understand. That's understandable. This is a life-changing thing. But I want you to know that, there is more waiting for you on the other side of fear, right? It's okay to feel scared. It's okay. We're human, right? But I will tell you, there is more waiting for you on the other side of that fear. So if you're afraid, we need to address that, the fear. Okay. So I wanted to leave you with that. I wanted to tell you that, again, if you're afraid, it's okay. That's normal. I'm giving you all this information not to scare you, but to equip you, right? I want you to know that it's normal, right? So, but there is more waiting for you on the other side of fear. There's more energy for you. Yes, there is. There's more confidence for you. Yes, right? Because some of us are hiding, we're dimming our light, we're not stepping into the light because of the weight, right? And it's not your fault. Society does not always treat us well because of the weight, right? We can be the largest person in the room, but people act like we're the invisible woman or the invisible man, right? It will give you more confidence. It will bring more joy to you. I promise it will. And more of you, right? More of you. So take your time, listen to your body. Some people are titrate up fast, they increase their dose fast. Some people slower. Listen to your own body. Don't look to the left or the right. Listen to your own body and trust that what lies ahead is worth it. What lies ahead is worth it should you decide to step onto this journey. Okay. So as I always say, and how I like to end this with, I want you to go out there. I want you to be bold, because it takes boldness to choose this, to make this choice, knowing what the side effects are, knowing what could happen, right? But the risks are here, but the rewards are there too, right? So I want you to be bold and make a bold choice and decision for yourself. I want you to be brave, because it takes courage, right? And it doesn't mean it's the absence of fear, right? It doesn't mean it's the absence of fear. You might have fear, but you do it anyway, right? And I want you to be brilliant, because you absolutely are. You absolutely are. And your light should never be dimmed. You should always be stepping into the light. And what I will tell you is that you will inspire so many people. People will be watching you, even if they never say anything. They'll be watching your journey, and you'll be inspiring them. So with that, I hope this was helpful. I wish only the best for you. I want you to be the happiest, the healthiest, the most brilliant version of yourself. And with that, I want to say good night. Take care. Thanks for tuning in. I will see you real soon.